Note its size, shape, and color. Normally the nose is straight with no deviations. The skin is smooth and unswollen and matches the color of the face. The columella is midline, and the nares are oval-shaped and symmetrical, with no discharge, flaring, or narrowing.
You can bring your chin down. Now I'm going to be pressing on your nose. Let me know. Okay?
Next, palpate the nose, placing one finger on each side of the bridge and moving gently over the soft tissues down to the tip. The nasal structures should feel firm and stable, with no tenderness, masses, or bone or cartilage displacement.
When I block this nostril, try to breathe in and out through the other.
Then check the patency of the nares by occluding one at a time.
That's good. Okay, now the other.
Through the open nares, nasal breathing should be noiseless and easy. Continue by inspecting the nasal cavity. To do this, use one hand to move the patient's head, and the other to slowly insert the nasal speculum, stabilizing it with your index finger. With the patient's head erect, inspect the nasal mucosa, vestibule, and inferior turbinate. Tilt the patient's head back to see the middle meatus and middle turbinate. Then move the speculum tip midline to view the septum. The nasal mucosa should be deep pink and glistening, with no discharge, masses, or lesions. The turbinates should be the same color, firm and unswollen. The septum should be midline and straight, with no perforations, bleeding, or crusting. Next, inspect the frontal and maxillary sinuses, which lie above and beside the nasal cavities. You should see no swelling. In a child under age 7, the frontal sinuses may not be developed yet, so focus your examination on the maxillary sinuses.
Can you pressing on your sinuses?
Also, palpate both pairs of sinuses. For the frontal sinuses, press your thumbs up against the brow bones. For the maxillary sinuses, press up under the zygomatic processes. There should be no tenderness or swelling. Now, with the patient's mouth closed, inspect and palpate the lips. They should be pink, smooth, and symmetric, and they should have no swelling, lesions, or other surface abnormalities.
Okay, that's great. Now I'm going to be examining your mouth. I need you to give me a big smile and clench your teeth.
Next, examine the buccal mucosa, teeth, and gums. Ideally, the upper molars should interdigitate with the lower molars.
Very nice. Can you open your mouth now, please?
Next, inspect the oral structures using a tongue blade and bright light. The buccal mucosa should be pinkish red, smooth, and moist. The gums should appear slightly stippled and pink, with a clearly defined tight margin at each tooth. Also, palpate the gums, which should be free of lesions, induration, thickening, masses, and tenderness. Then use a tongue blade to probe each tooth, which should be firmly anchored. Note any wear, notches, caries, or missing or loose teeth.
Can you stick out your tongue and hold it, please?
Next, inspect the tongue. It should look dull red, moist, and glistening, and should have no coating or ulcerations. The tongue should protrude fully, remain midline, and show no deviation or tremor.
Now I need to look under your tongue, so please keep your tongue and put it behind your front teeth.
Normally, the ventral surface of the tongue is pink and smooth, with large veins between the frenulum and fimbriated folds, but with no swelling or varicosities. In an older patient, however, varicose veins under the tongue are an expected variation.
Now I need to look at the sides of your tongue.
Wrap a piece of gauze around the tongue and pull the tongue to each side to inspect its lateral borders. You should see no white or red margins or ulcerations.
Okay, that's great. Now I'm going to feel inside your mouth.
Continue by palpating the tongue and floor of the mouth. The tongue should feel smooth and even in texture, and you should find no nodules, ulcerations, or areas of induration.
Now I need you to tilt your head back, open your mouth wide so I ready to take a look in his throat and this.
If a young child resists the oral examination, ask a parent to hold her with one arm across her arms and the other across her forehead to restrain her gently yet effectively.
That would be great. Okay, say out.
Usually the whitish hard palate is dome-shaped, has transverse rugae, and smoothly meets the pinker soft palate, which extends to the uvula at the midline.
Okay, you can straighten your head up. Great, now I need you to open wide and say out.
As the patient vocalizes, the soft palate should rise symmetrically, and the uvula should remain midline.
Okay, that's great. Now I just need to look at the back of your mouth, so if you can open wide.
When inspecting the oropharynx, observe the tonsillar pillars and retropharyngeal wall. If present, the tonsils should be pink like the pharynx and shouldn't project past the tonsillar pillars. The retropharyngeal wall should be smooth, glistening, and pink, with small blood vessels and spots of lymphatic tissue.
Last thing I need to do is put your bag reflex.
Using a tongue depressor, touch the posterior wall of the pharynx on each side. This should elicit a bilateral response. By using inspection, palpation, and a few special techniques, you can easily examine your patient's ears, nose, and throat. And by putting these findings together with the health history and diagnostic test results, you'll have a clear clinical picture that can guide your patient's health care effectively.